Our next session is Mind Matters, an exploration of lifespan mental health in COVID-19 times by Dr. Pratima Murthy, Dr. Shekhar Seshadri and Dr. Soumitra Pathare in conversation with Dr. Ennapadam S. Krishnamurthy. Mental health are amongst the two words that we most often heard alongside the words virus, pandemic, quarantine, lockdown. Concerns over mental health have seen a surge in the last 20 months, forcing people, industries, medical professionals and almost everyone to reshift their focus and recognize the brutal effects of COVID-19 and its effects on our mental well-being. We are really looking forward to this esteemed panel of speakers shed light on this very important subject. Let me take a moment to introduce the speakers. Dr. Shekhar Seshadri is a child psychiatrist with over 35 years of experience in the field of child mental health. As senior professor in the Department of Child and Adolescent Psychiatry and Dean of the Behavioral Sciences Division, NIMHANS, his work extends beyond the clinical population to children and child care institutions, service providers across the country, as well as the South Asia region. He's also an artist and a musician, and he uses a number of creative methodologies in child mental health interventions, including theatre and developmental approaches, in the belief that wider psychosocial interventions are rooted in child rights. In addition to his preventive, promotive and curative child mental health interventions, he has undertaken various legal and policy-related initiatives. Dr. Soumitra Pathare is a consultant psychiatrist and the director of the Center for Mental Health, Law and Policy, Indian Law Society, Pune. His primary interests are in the areas of suicide prevention, mental health policy, scaling up mental health services, rights-based care and legislation. In the past, he has provided technical assistance to the Ministry of Health and Family Welfare, Government of India, in drafting India's Mental Health Care Act 2017, which takes a rights-based approach to mental health care, and has also served as a WHO consultant in many low and middle-income countries. He has conceptualized and steered various innovative community-led mental health interventions, and he strongly believes that all persons with mental illness should be able to fully participate in society as everyone else. Dr. E.S. Krishnamurthy is a behavioral neurologist and neuropsychiatrist, the founder of Buddhi Clinic and a pioneer of integrated and holistic care and rehabilitation for the brain and mind. He has taken on multiple international leadership roles in treating epilepsy, dementia, and in the field of clinical neuropsychiatry. He has to his credit 70 plus publications, 30 plus book chapters, and over 25 articles in the press. He is adjunct professor at Manipal University and Public Health Foundation, India. He is also senior clinical advisor in neurosciences, Apollo Hospitals Group. Dr. Pratima Murthy brings about 30 years of extensive experience and exceptional accomplishment to the field of mental health. She was professor and head of the Department of Psychiatry in NIMHANS in Bangalore until she took over as its director in mid-2021. A well-recognized leader in the field of addiction psychiatry, she has been instrumental in the development of state-of-the-art Center for Addiction Medicine at NIMHANS. She has served as a consultant to prominent international agencies such as the United Nations Office on Drugs and Crime, the International Labour Organization, and the World Health Organization. Dr. Pratima is also recognized for her work with the National Human Rights Commission on Quality Assurance in Mental Health Care, both in institutions and in the community. Dr. Pratima has received numerous awards and honors. Among them is the WHO Regional Director's Special Recognition Award on World No Tobacco Day 2021 for her remarkable service in tobacco control. Author of more than 300 research publications in various international indexed journals and scientific books, she has also co-edited with Dr. Sanjeev Jain and Dr. Alok Sareen the path-breaking volume, The Psychological Impact of the Partition of India. Dr. Murthy, Dr. Seshadri, Dr. Pathare and Dr. Krishnamurthy, over to you.
Good day, ladies and and gentlemen, and welcome to this year's edition of Lit for Life. It's a great pleasure to have with us Professor Pratima Murthy, Professor Shekhar Shishadri, and Dr. Soumitra Patare. And all of them are experts on mental health. And this session is going to explore the domain of mental health across the lifespan, in particular during the COVID-19 pandemic. Pre-pandemic, maybe in November 2019, most of us could not have imagined how the world might change due to a virus. We had thought of world changing due to wars, due to internal strife, but we never imagined a virus could change the world. And of course, COVID-19 came along and we saw the impact in early 2020. And from then, all our lives have been magically transformed, but not necessarily in a nice way. And one of the things that has definitely changed in this time is the impact that the pandemic has had on mental health across the lifespan, and indeed the awareness of how important mental health is as part of human health. Very often, we as a society have failed to recognize that health is not just physical, it is emotional, it is spiritual, and we don't see it in that holistic way. The pandemic, I believe, has turned all this around on its head, and it's made us think as a society about mental health. And I'm very happy, therefore, that Lit for Life, led by the chairperson, Nirmala Lakshman, have decided to focus this year's mental health discussion on the COVID-19 pandemic. And we will be talking in the next hour or so about the COVID-19 pandemic and its impact. Let me start by asking my panelists, starting with Professor Pratima, would you agree that mental health is more important than ever during this pandemic? And can you share some personal anecdotes or experiences that you've come through in this time to kind of emphasize this?
Krish, we've always said that there is no health without mental health. But I think that kind of remained an empty slogan till COVID came along, when we realized in some ways the devastating impact it had on all our mental health. Take the different phases of the pandemic. During lockdown, one of the biggest worries was because we just didn't have the right information about how the virus spread. There was a lot of anxiety. There was a lot of misinformation that all of us were kind of exposed to. During lockdown, it seemed fun initially, getting back to families, working from home. And it indeed, a lot of people adapted to it well. But for many others, this kind of abrupt transition of not having a workplace to go to, or having to adjust with other people at home, yielded a lot of problems, especially during the course of the pandemic. And then, of course, the actual sickness, hospitalization, worries about children, worries about the elderly, these were causes for anxiety in a lot of people and stress in a lot of people. I don't think we've still seen the aftermath of COVID. You asked about personal experiences. I mean, there have been several personal experiences for me, both as a professional, primarily as a professional. One of the things was in a large institution, making adjustments with our students, with our faculty, with their families, some of them falling sick, some of them exposed and testing positive. There were so many issues, but what stands out in my mind is that of a mother who lost two of her sons-in-law during the time of the COVID. We still don't know whether they were COVID-related deaths, but the tragedy is that both these men were in their late 30s. They both suddenly died after a brief illness. There were so many issues. I mean, it was enough confronting death itself, but then the fact that these young men had to be brought into hospital, they had to undergo autopsy, The families could not participate in their rituals, the kind of procedures that they had to, go through, and then the fact that they were alone in their grief. I think this is the most poignant part of the whole thing, that when people had to face death and trauma, it was extremely, extremely difficult and a very, very lonely part.
Thank you. I know that grief has been a very big accompaniment of this pandemic for many families, and unexpected grief. And as you point out, grief which you cannot face together with your loved ones, grief that you face alone, has been such a very big impact during this time. Professor Sheshadri, you have a special interest and expertise in children. Could I request you to share your perspectives and what you come across?
There are several phases of the narrative, Krish. If you really look at it from the first wave, the second wave, the imminent third wave, but there is also reference to the fourth wave, which is likely to be a mental health related issue. And already the explosion of literature on the mental health impact of COVID across the world is there for our reading interest and concern. We have actually done some elegant structural equation models to really look at patterns of coping and stress, particularly how children have coped with the issue. As Pratima pointed out, after the initial euphoria of schools being closed and not really understanding the nature of the pandemic, once the second wave, in comparison to the first, which was about older people with comorbidities, and the second wave where younger people, including those who were vaccinated, people in their 50s and so on, were being taken away, and the whole issue of children losing their parents to the disease, and the whole change of narratives and the angst and the resentment about hospital beds and oxygen, and those elements of frustrations in the narrative. But if you were to cull this down in terms of what has happened to children's lives, what have they suffered in terms of loss, loss of routine, loss of structure, loss of predictability, loss of educational opportunities, loss of social spaces, loss of peer interaction, and loss of play? And what impact does this have on children's lives? And on the subject of loss of predictability, one of the issues that is being spoken about extensively related to the anxiety that Pratima referred to is a cross-cutting phenomena across many kinds of mental health conditions, and that is called intolerance of uncertainty. There is no predictability as to how many more years we will reach, if at all, a pre-pandemic situation. If you look at the Spanish influenza, where upwards of 30 to 40 million people died, and the number of years it really took for that phenomena to resolve. Are we looking at a similar situation? So to come back to the point, Krish, COVID that you made, COVID has really caused a rupture in human existence. This non-living form of RNA, the collective weight of it and the devastation that it has caused is probably about, I don't know, 100 grams or and the devastation it has caused. So we are increasingly now dealing with newer narratives in children's lives. As schools open, this is not just about safety protocols and bridging the learning gap. Which mental health context are they coming back to school? Have they come from families where there was already a pre-existing theme of marital discord? Are they coming from abusive backgrounds? Have they suffered loss experiences? And how do we factor all this in the kind of interventions that we do, and indeed in the kind of policy that is required to account for these emerging realities? Over to you, Krish.
Thank you. Dr. Putare, if I could ask you the same question, and your experiences at this time and how mental health has changed in the community and been effective.
I want to make a couple of points to add to what Shekhar and Pratima have already said. One of the things that during the COVID pandemic happened was that middle class India discovered mental health. Suddenly realized that, oh my God, these things happen to us. The fact of the matter is that 150 million people in India have had mental health problems even before the COVID pandemic, as the National Mental Health Survey showed. So it wasn't like it wasn't there, but we had invisibilized mental illness because it didn't happen to people like us, or at least that's what we thought. And here suddenly, people who thought that this is not stuff that happened to them, this happened to whatever the stereotypes that people have about mental illness was happening to them. And the second thing was that what it has resulted in, we've always had a shortage of mental health resources, human resources, because that's what mental health is about. Doctors, psychologists, counselors, and all of that. And we've already, if you look at the data, we have had like 85% treatment gap, 85% treatment gap. What does that mean? That 85 out of 100 people in this country never got treated for their mental health problems. This is pre-COVID, okay? This is not post-COVID. What has happened post-COVID, I think, and this is very visible, is that because a more well-off and vocal class of Indians has suddenly got problems with mental health, they have now crowded out everybody else out of these very meager mental health resources. So you see, you have this paradox of people who already had severe mental health problems or had mental health problems in the past and came from disadvantaged backgrounds and did not have treatment. They were even less likely to receive treatment because those meager resources are now being cornered by people who are very vocal about their needs. So, in a very odd sort of way, while mental health problems have increased, the accessibility to treatment has actually decreased for people who come from disadvantaged backgrounds. Over to you.
Thank you. I think that's such an important point that while access should have increased and it should be more easy for people to seek help, what was already a very strained system is even more under strain because we have a group of people who are more vocal and able to ask for help. I think it's a very, very important point. Professor Murthy, if I could, as a leader, you're the director of NUMANS, a very successful mental health professional, and as a woman, if I could get you to just highlight what challenges have been for women in this time during of the pandemic.
Yeah, I mean, I think it's a global phenomenon that women have been disadvantaged as far as mental health care goes, and I think this is around the world. But I think the pandemic has thrown up several issues as far as women is concerned, and again, in addition to the treatment gap, the fact that the services are not very gender sensitive is yet another thing that gets thrown up. Particularly for women, we know that there have already existing economic disparities. Even for working women, there are multiple roles that they need to play. There is a lot of stigma around help seeking. Support systems very often fail women who need services. We've also seen an increase in domestic violence, not just in our parts of the world, but even in the developed parts of the world. Women have been burdened, for example, especially working women, not only working from home, but managing children at home, particularly with schools being closed, or these issues. Domestic violence is yet another issue that we are quite aware of. And everywhere in the world, it is predicted that the economic disparity is going to affect women much more than men, especially women who have who are in a lot of unpaid work, and are already facing financial difficulties. This can be more. The other thing is in continuation of what Samitra was saying in terms of support services. Now, it's very difficult for women to access services as readily as other people. And therefore, unless the services reach women, it's just possible that, they will not get the services. We've had the psychosocial helpline at NIMHANS, which has actually offered help during COVID, and more than 6 lakh calls have been received during COVID. And some of these definitely are related to this kind of distress that we talk about, the domestic violence and so on. Or the Women and Child Welfare Department has also initiated mental health counseling at the one-stop centers for women. But we need to train people. And Saumitra mentioned about the lack of trained human resources. So in terms of being compassionate, empathetic, communicating with people who have distress, we have a huge need there, which we need to reach to the more disenfranchised and vulnerable populations, including women.
Thank you. Professor Sheshadri, you work with children who have special needs, and I'm sure that landscape has changed considerably during the pandemic. Would I request you to tell us how pandemic has impacted mental health of these very special children?
Krish, I would like to predicate my response on certain other realities that we need to keep in mind. Pandemics of the nature of COVID have a disproportionate impact on the more vulnerable populations. Day before yesterday, October 10th, when the World Federation of Mental Health was recognized, and on the theme of inequality. This is very interesting because I often ask this question of people, what is equality, or how do you define equality? And a default mode response is to say that equality is treating everyone the same. I often say that's the wrong answer, because equality is actually about recognizing differences. Maybe a better term is equity or inequity, because if you look at equality of opportunities or equality of access to services, the truth is that for every child who manages to reach a tertiary care center for assistance, there are 99 others who will never manage to reach, for the reasons that Soumitra has pointed out and Pratima reiterated. So if you look at the suddenness with which the lockdown was announced, and if you look at marginalized populations, daily wage workers, migrant workers, their children, and if you look at the childline statistics about the calls that came about increasing incidents of abuse, as well as the whole risk and reporting of both child trafficking and child marriage. And then you bring in the conundrum of children with special needs, for whom special services were imperative to keep their developmental trajectories on track. I mean, the schools were stopped universally during the first wave and extending into the second, and indeed into what we expected to be the third wave, where it was said that children would be more vulnerable because the virus would target unvaccinated. The virus needs a host. And it would obviously target vulnerable people, including children who are hitherto unvaccinated. So this has been a predicament for both families as well as organizations that work with special needs children. And when we speak of child protection, the notion of child protection encompasses both acts of commission, but there are also acts of omission. And if you look at the whole predicament of families in difficult circumstances, it would not be wrong to say that COVID is a current pandemic. Adverse childhood experiences, or ACEs, has been an everlasting epidemic. And the differential impact of adverse childhood experiences, on the one hand of neglect and abuse, but on the other hand of unmet developmental needs. The risk of unmet developmental needs, and what would that do to the developmental trajectories of children with special needs? And would their deficits in development actually exacerbate, particularly when the family is struggling to keep the kitchen going, and would the training and stimulation of the child therefore be compromised? So these are very serious issues that we have been contending with And in this context, due to our firm belief in enhance in public mental health, and in my context, public child mental health, um, about a year ago, in fact, before the pandemic, we were already doing 6, 7 years of robust community work. And in 2019, before the pandemic, we presented a proposal because the government wanted us to do this on a national basis. And before the first lockdown actually came, our idea to start a national initiative and integrated resource for child protection and mental health was actually approved, and we've been operational for 1 year. And we are working in 29 states and 2 union territories right now, addressing precisely these issues with duty bearers and service providers. And Krish, it would interest you to know, since in our preliminary discussion you were talking about policy, this is the first time in the history of a project in NIMHANS that we actually have a vertical on policy and law, in addition to mental health, education, and child protection. So, and I can see that Shomitra is also pleased with the idea, that given his deep interest in policy and law, that I think it's absolutely critical that we address policymakers in looking at provisions for special needs children. So this is what we have been doing, and to have reached almost 1 lakh service providers through 350 training programs across 29 states, and almost 20 lakh views through our public media focusing on special needs, we are hoping to make an impact on this very, very critical sector. Krish?
Thank you. That is very, very heartening to hear about the effort from NIMHANS to have a very large public health program. Congratulations. I'm very, very pleased to hear about this, and I'm sure everyone in our audience will be as well. Dr. Patare, if I can ask you about adults during this pandemic, do you see a rise in problems? Are there specific groups that are more vulnerable, and how do we help these people?
Well, let me carry forward on what Pratima and Shekhar have been talking about. And Pratima and Shekhar are obviously far more diplomatic than I am. So I tend to, and everyone knows that, I tend to kind of be too blunt about this. But the fact of the matter is that we've always discriminated against people with severe mental illness. We have always excluded people with severe mental illness from our communities. And the COVID pandemic just brought that starkly to light, to the extent that we were willing to sacrifice their lives. And let me give you a concrete example to prove what I'm saying. There is enough research from across the world which shows that people with severe mental health problems have the second highest risk factor of dying after age. So after age, what is the second highest risk factor for death after COVID? That is severe mental illness, especially schizophrenia. When we announced the prioritization of vaccination for, which were the groups we decided to prioritize, we said, we'll put all the vulnerable at-risk groups in priority. So we took the elderly first. We took people with diabetes and hypertension and people who worked in healthcare. But we just completely forgot people with severe mental illness. This is not by accident. This is overtly not by accident, is what I would say. And it finally took someone to go to the Supreme Court to get the Supreme Court just a week ago issue an order saying that all people with severe mental illness in mental hospitals across the country should be vaccinated forthwith, and a status report should be submitted. Now, why does it require something like this for an intervention from the Supreme Court? And why does the Supreme Court intervene? The Supreme Court intervenes because it can see discrimination. Otherwise, the Supreme Court would have said, this is a medical decision, nothing to do with us. So clearly, we've kind of institutionalized the discrimination during the COVID pandemic. And remember, even the Supreme Court order covers the 40,000 odd people who live in the mental hospitals. It does not cover the millions of people with severe mental illness who live in the community. And very often, many of them will not get the vaccine because they will live in conditions of poverty. They may not have access to their own financial resources to be able to pay for the vaccine. And some of them will get excluded merely or have been excluded for so long merely because of the age issue. You know, someone who's a 30-year-old living with schizophrenia for the last 15 years, they won't get prioritized for vaccination. You don't even know if their families will prioritize them for vaccination. So, you know, what the pandemic has starkly brought into focus for mental health is the kind of discriminatory practices that have always been very covert, but being now overtly practiced, where we are willing to risk the lives of vulnerable people.
Thank you. I think it's such an important point for us to all keep in mind that somehow we forgot mental health when we talked about prioritized populations. Professor Pratima.
Yeah, Chris, I just felt I needed to come in here because I think it's also important to talk about certain positives that have occurred in addition to the negative narrative. And I think I'd like to talk about my experience when I was, leading the Department of Psychiatry. And this is an issue that we were very, very conscious of, that people with severe mental illness are likely to be one of the most vulnerable populations. And we'd been reading about other parts of the world where entire populations of elderly, for example, with dementia got wiped out in nursing homes. So one of the conscious decisions we took is that our patients with severe mental illness were vulnerable, and we were really frightened because, you know, they live in a dormitory like situation where they're actually exposed, and if the virus comes into one of the wards, you can be sure, and we certainly had that experience. And in the absence of very clear cut guidelines, we had to evolve guidelines to make sure that if there was a case in the ward, the others were protected. And this was a very challenging situation. But I think that we demonstrated that with the right kind of attitudes, you could actually make sure that vulnerable populations were taken care of, including vaccination. I take Saumitra's larger point that this needs to be, in terms of a policy, expand to other people with mental illnesses, but we need to demonstrate that it is indeed possible, even in our own circumstances, to be able to, you know, take the disenfranchised into account when we plan services.
Thank you. In our own experience working with elders with conditions like dementia, Parkinson's disease, and stroke, we found the impact of the pandemic has been very substantial. I mean, for example, we are all using the wonderful technology today to have this webinar and discuss with each other. Many elders don't know how to access the technology or did not know how to access the technology. And the pandemic also meant that they had no one to assist them. And I think, therefore, elders have been hugely disadvantaged in terms of access, even to their regular doctors, to regular services, or even the ability to access those services, either because of lack of technology or lack of access to technology. And I think that this is something that was very striking to us when we were looking after these elders. They also had enormous fear that even essential rehabilitation, to let people to come in and work with them, was something that they were terribly frightened to do. And of course, in many middle-class families, even if the children could not be with the elder, they were constantly telling them, don't let anyone in, don't have contact with anybody. So there was this kind of catch-22 situation where this person desperately needs medical or mental health help, but is unable to access it. And I think that those factors and the fact that we don't have a good formal caregiving system, a trained caregiving system that supports the elder, it became very, very apparent during this time. And many elders were left without proper caregiving, or with caregivers who were kind of part-time or informal, could hardly manage their needs. And of course, many did did suffer the COVID infection, and post-COVID had a number of complications, including going into a confusional state or a delirium, having their cognition impaired. And I think to add to all this, the fear and the loneliness. So the one group, while they did get vaccinated, or they did get priority for vaccination, the one group I think that suffered considerably during this pandemic are the elders. And even with elders who are perfectly capable of looking after themselves and have access to technology and are empowered, loneliness, I think, has been a huge factor that has played a role in terms of their mental health. And I thought I should highlight that particular group and the challenges that they've been facing. And I'm sure if one goes towards rural India, it's probably been, or small town India, it's probably been much worse than what we are seeing in the urban setting. I wanted to take discussion to specific populations, and I'm going to let you, each one of you, just pick the thing that you want to talk about. So I'll start by asking about vulnerable populations, those with disability and chronic disease. Would someone like to start?
So let me start off with a group that I work very closely with, people with substance use disorders. And I think what happened during the lockdown is that many of them were left in the lurch. Many of them with alcohol dependence particularly, they had acute withdrawal, complicated withdrawal. They didn't know where to go to seek help. And we know that when there is complicated withdrawal, seizures can occur. There can be other complications as well. Very strangely enough, different countries have demonstrated different effects of the pandemic during the different phases of lockdown and post-lockdown and so on. So in terms of hoarding, alcohol or other drugs, or in terms of getting online supplies, in terms of the problems of road traffic accidents reducing in some places because of a reduced consumption of alcohol, you find very different kinds of patterns. But the most important thing is to recognize that addiction is something that needs treatment. And therefore, making treatment available for this vulnerable group becomes very, very important. With tobacco cessation, we notice some other very different phenomena. For example, again, when stores were closed during lockdown, there were many people who attempted to abstain, and a small number who were not perhaps very dependent were indeed able to abstain. We run a quitline, tobacco quitline at NIMHANS, and although the number of calls coming to the quitline had reduced, the number of people with a serious intent to quit had increased. And that was perhaps understanding that there are complications, particularly to the lungs, and the fact that people who had smoking might have reduced immunity. And the quit rates after counseling had actually doubled during COVID. So I think those are certainly, some positive responses. But we also know that, for example, in opioid addiction, the fact that opioid substitution treatment could not be available to many people. So you had a change in the patterns of drug use. And I'm sure we're going to see that as a constant problem. The other, of course, are concerns about access to technology. That's something that you mentioned. And in terms of what Shekhar was talking about, there's a lot of distress among children who are not able to access technology to go, to participate in the online classes, particularly when appliances have to be shared. And again, on a gender-based thing, girl children had this problem even more acutely than boys. And of course, ironically, the use of technology also has its negative consequences. There are lots of concerns about use of technology, mobile addiction, internet addiction, accessing sites that, are detrimental to young children, technology addiction and so on. So I think we're going to see a whole lot of changes in terms of chemical and behavioral addictions as a consequence of the pandemic that we need to be, ready for. And the fact that people tend to use substances to deal with stress. So given so much stress, and that's across the board, children and adolescents, women, elderly. So I think in terms of being able to help them to deal with stress in more healthy ways, we need to evolve mechanisms across the board.
Thank you.
I would like to build, Krish, on this, as well as the 80 to 85% mental health gap that Soumitro referred to. In fact, I'd given a talk day before yesterday, the title of which was MH Gap, Meta Minorities and the Little Unequals. The Little Unequals is a twist on George Orwell's comment in Animal Farm, where he says all men are equal, but some are more equal than others. The twist was that there is inequality, but some people are more unequal than others. And meta-minorities refer precisely to the population that Soumitra referred to, where it was forgotten that people with severe mental illness should have been prioritized for vaccination. And this form of exclusion, so children with disability, children with special needs, children as a whole, as a vulnerable population, children who come from difficult families and compromised families, and the kind of trials and tribulations that they endured and experienced pre-COVID, which was only accentuated during COVID. The issue of substance use that Pratima referred to, if the theme of alcohol consumption or substance use disorder was present in a parent pre-pandemic, and during the lockdown, because of frustration, supposing the substance use increased, escalating into domestic violence. And so these are the kind of narratives that have played out in children's lives. So one of the things that I think that the mental health fraternity needs to seriously consider, particularly child mental health and developmental psychology, and this is mind-boggling. Krish, it's like this. If we're talking about a 1 month or a 3 month old child, even pre-pandemic, they are more or less at home. They're being fed and so on. If you're talking about the 15, 16, 17-year-olds with their frustrations and constriction in their social lives, they have their means of navigating, perhaps transforming into the kind of the digital use and behavioral addictions and so on. Not to mention the whole issue of the digital divide, exactly an example of inequality. I'm talking, Krish, about the 4, 5, and 6 years old and those with special needs. So this lockdown, as it is, their mobility, if they had locomotor disability, cerebral palsy, and intellectual disability, as it is, their mobility was compromised. So this lockdown within a lockdown, has developmental psychology considered the evolutionary psychological impact of the pandemic on the 3, 4, 6-year-olds? What is going to happen to these kids 2 years from now, 5 years from now? So we are talking about the imperative for some really robust developmental, ongoing, longitudinal, prospective research to look at and we have the occasion and the imperative to do so. So this is exactly what we are trying to do in the national initiative that I alluded to, which is called SAMVAD, which is an acronym for support, advocacy, and mental health interventions for children in vulnerability and distress. Interestingly, it is supported not by the Ministry of Health, but by the Ministry of Women and Child Development, for the simple reason that the child protection systems do not understand the nuances of mental health, and the mental health system does not understand the complexities of the child protection system, particularly where vulnerability is concerned. And the whole idea is the imperative now of transdisciplinarity in the way that we function, which is why we are trying to reach these vulnerable children in the mental health sector through our work with the district mental health programs, tertiary care institutions, and other bodies like the University Grants Commission, which actually has an initiative called Manodarpan. They are looking at vitalizing well-being and mental health in all institutions of higher education. And we are in the education sector, and in the education sector, we are working with state and central education boards, and also with the Anganwadi system. The ICDS is the world's largest welfare program, and we have an occasion there to actually input. And in policy and law, we are working with the child welfare committees, JJ boards, the judiciary at the state and national level, legal services authority, paralegal volunteers. And in care and protection, we are working with childcare institutions and in policy and law and childcare institutions, and also with helplines like Childline and other state and helplines, including feeding into the NIMHANS helpline that Pratima referred to, which has received enormous number of calls there. So that's the kind of scaffolding that we're trying to create to meet the large gap that Soumitra alluded to in his opening comments. I believe, again, like I said, that the whole community psychiatry movement, when it started in the late 70s and 80s, needs to be repurposed and revisioned. And this is what pandemic has done. We need a reset to the rupture that the pandemic has caused. And I think this is the occasion to really re-examine public mental health and put robust systems of, and we have the opportunity. We need to really capitalize on this, Krish.
Thank you. Thank you so much. Dr. Butare, obviously, one of the things that's happened during the pandemic is the loss of livelihoods, migration, and the exacerbation of poverty. Could you tell us about the impact on mental health and vice versa?
Thanks. I think one of the topics that has not come up in this discussion, or the word that has not come up in this discussion, is suicide. And I wanted to pick up on what Pratima said about domestic violence, and also the whole issue of alcohol, because in many ways they are the triad in India, is domestic violence, alcohol, and suicide. And we haven't really talked about that. So let me try and explain what I mean. Even pre-pandemic, okay, this is before the pandemic. If you looked at our suicide data, then about 1 out of 3 women who died of suicide had a history of domestic violence. Okay, so they would have a history of having lived with domestic violence. If you looked at the data for men, then alcohol was implicated in about 1 out of 3 of men's suicides. Okay, so clearly domestic violence and alcohol have a huge impact on suicides in India, at least. Forget the rest of the world, but specifically for India. And now you add into this the 2 things that Pratima said earlier, which is that domestic violence calls for examples have gone up dramatically. So what has this done to suicide rates? We don't know, because we don't have the data. The NCRB hasn't yet put out the data. But one could presume that if domestic violence is so closely linked, and given the stress of the pandemic and all, that if domestic violence rates have gone off, then maybe suicides among women, especially married women, might show a spike. The second is alcohol. And we did a study just after the lockdown was implemented. And I don't know if you will recall, but in the first 4 or 5 weeks after the lockdown, there was a spate of alcohol-related suicide, alcohol withdrawal-related suicides. And also alcohol withdrawal related deaths, which were because people trying to substitute it by drinking chemicals or all sorts of things and dying, So they were not necessarily suicides, but you could argue that it's self-harm of a kind. And that died out after 4 or 5 weeks. And the reason it died out is very clear. After a while, what happens is your withdrawal is over, and you're no longer in that situation where you're likely to kill yourself because of it. So, I think that there is also a bigger moral question that those particular suicides, which were alcohol withdrawal related, do raise. That, the moral question is the issue of, if you know that somebody is dependent on alcohol, if you know that they are likely to die in withdrawal, we know all of these things. These are not new facts that we are suddenly discovering. Then was it ethically and morally right to impose a complete lack of access to alcohol without providing access to treatment? I mean, I'm not taking a alcohol morality stance. Okay, it's not that I'm trying to promote alcoholism or alcohol consumption. What I'm only saying is that if you wanted people to quit alcohol, if you're going to reduce access to alcohol such that it makes them feel suicidal, then isn't it also our responsibility to provide access to alcohol withdrawal services, which was not so easily provided? And with the lockdown, how are people going to access those withdrawal services is a question that should be asked. In fact, the whole issue of alcohol withdrawal, if you remember, just after the lockdowns were lifted, became a very moral issue. If this whole issue of why do people need to drink? I mean, why can't they stay without alcohol for a while? So we actually made it into a moral question, which was really a public health issue. And The other thing about suicides that we've not talked about, and which is what worries me, if you look at previous crises, especially economic crisis across the world, okay, there is more than sufficient evidence now that after a time lag, economic crises result in spikes in suicides. Now, the most recent of that was Greece. Okay, Greece, if you remember, had the big financial crisis in 2008, where they almost went bankrupt. And there is sufficient data now to show that in the subsequent years, 2009, 2010, 2011, 2012, Greece saw dramatic increases in suicide rates. And this is a pattern which has been repeated across the world. It's not the first time. It's not going to be the last time. Uh, Funnily enough, when you have war, suicide rates drop during war, but increase after the war ends. Again, what happens is that during the war, maybe there's much more of social cohesion and this thing of having to work together. And then when the war ends, it becomes each one for himself or herself, and that's when the suicides increase. So if history is going to be any predictor, then in the coming 3 or 4 years, we should be prepared for, and in fact, we should be doing something about it now, for this potential increases in suicides that we are going to see in the coming years. My worry is that we will do nothing about it now. 4 years later, there will be a lot of chest beating and bleating about it and saying, oh my God, what's happening? Whereas if we just knew, if we know the data, if we did something about it, we could actually intervene now. Putting in place protections to prevent suicides and to reduce attempted suicides is something that we need to be doing now. Not and so forget what we didn't do in the last 12 months is what I'm saying. Okay, all the vaccine issue and all, leave that aside. We didn't do a lot of things right in the last 12 months. We did a lot of other things right. But going forward for the next 36 or 48 months, what are we going to do differently to save lives? And that is something that we should be focusing on.
Thank you. In fact, our work in Buddhi Clinic has been focused on holistic mental health. And one of the things that we did during the pandemic was prepare Ayurveda and naturopathy kits and dispatch them to a range of people, including people with chronic disability. And we supported them in the do-it-yourself use by online WhatsApp calls. So no fancy technology, just going online on a WhatsApp call and telling them what to do with the kit. And very interestingly, we've had people take this up and we are in Chennai in Tamil Nadu. We've had people take this up as far as rural Maharashtra, rural West Bengal, and benefit and ask for repeat kits. So it's been a very, very gratifying experience to try and help people. One very interesting story that came out of it was a feuding mother-in-law and daughter-in-law who were both recipients of the kit, helped each other out, and it helped them understand each other's sufferings. And it brought down their concerns about each other considerably. So the whole thing about empathy, the whole thing about how humans cope during difficult circumstances. And I think on a very positive vein, the pandemic has probably taught us a lot about human resilience as well. I think world over, and especially in India, we've emerged as a very resilient society that's capable of living through what has been a very difficult experience. And I think that we should not underscore the importance of that, because I think it is so, it's such a good thing to know that people have that within them to cope better. I wanted to finish off by asking you, this being Lit for Life, what you've been reading recently. So please tell us the book which is on your bedside and what that's teaching you about mental health.
Well, more than reading, Krish, I've been doing a lot of writing. And in order to write, of course, you have to read. I've been writing a lot of material for children and for people who look after children. So as part of Samvad, we are running, we have a YouTube link, which is, and a website, which is an upgraded website on which we are writing a lot of stories for children. So, and a lot of stories for caregivers and service providers to use with children. So these are how do you work with loss and grief? How do you work with stress and anxiety? And we are putting out all this as we work with teachers and other people who look after children. So I've been doing an extraordinary amount of writing. In journals of pediatrics and in psychiatric journals as well, particularly to table the imperative now of child protection and child mental health. Of course, there has been so much of an explosion on COVID literature that I'm keeping in touch with them. I've been um, reading commentaries and articles written by Soumitra Pathare in the Lancet. That's what I've been reading. And of course, it was interesting offhand to read some of the old stuff, such as Albert Camus' Plague and Life in the Time of Cholera by Gabriel Garcia Marquez, to really look at what those texts really mean in terms of the way that we reinterpret. I've been reading a lot of blogs as well. There's a particularly moving blog by a Delhi-based journalist called Mohammad Asim, who speaks about when pain is collective, then its cuteness gets shared. And he speaks about very many evocative stories about a young man who had recovered from COVID and goes to donate plasma to a person who he hears ultimately passed away. So he grieves for a stranger, and the story of the young gentleman whose mother was in a hospital in Calcutta, to whom he sings on the phone, "Tera mujhse to pehle ka naata koi," and he says, "Can you ever listen to that song without tearing up?" That so there are a lot of these stories, and what I want to say, Krish, finally, is about the poverty of epistemology. We somehow believe that knowledge is generated from double-blind studies and research, and we forget about the subjectivity of the lived experience of people. And I refer to this as the poverty of epistemology. So yes, that's what my life has been like in the last 1 year.
Thank you. Dr. Pathare.
Well, I'm really thankful for Shekhar to say it and put it that way, because usually I get asked this question and I'm always embarrassed and sheepish enough to say that I'm not actually reading because I'm busy writing. So Shekhar made it very easy for me to say that. I'm busy writing, and we've got a book coming out next month, and I know the publishers are on my back. This is a couple of colleagues and I who are doing a book on suicide prevention, largely for the general public, not for academia. I think a lot of the data and the research and academic work is not accessible to the general public, and we need a lot more public debate and discussion on what are we doing to prevent suicides in our country, or not doing to prevent suicides in our country. So I've been busy with that, busy writing, and as Shekhar said, also busy with too many other things. There's a pile of reading books. The only books I've managed to end up reading have been because somebody's asked me to do a review of the book. And so I'm forced to read it in time and write up the review. And just recently, I've been sent Daman Singh's new book about asylum to have a look at it. So I'm going to have to read that in the next few weeks. So let's see how it goes.
Thank you. Was Pratima.
Yeah.
Sorry.
So if my colleagues have been busy writing, I've been busy doing. So there's been several things that needed to be done, particularly, starting off for almost 1.5 years now, setting systems in place, the anxiety of changing guidelines practically every day at that time, and things that had to be implemented, making sure a creativity was encouraged amongst our students, because I think for a whole year, what we did was we made sure that they came up with poetry, they came up with writings. Just yesterday, we had a musical release of something called Mugs to Mike, talking about how you need to provide solace and compassion. Mere Saath Rehna, a video poems on suicide, poems on loneliness, which are all available on various blogs. I've been doing that, but I think more importantly, what I have actually done is attended classes on the Bhagavad Gita. It's not that I did not know the Bhagavad Gita, but I think during the lockdown, there were a lot of opportunities. And to do that with the family has been a very, very enriching experience for me. Really understanding, going through the different stanzas, learning to apply that in my own life, in professional life, but more importantly, I think teaching people the values of what the kind of things that we mentioned: compassion, care, and humanity for all others, and in some ways to universalize our own suffering and loss and help each other along. I think COVID has taught us that mental illness is not, so Samitra referred to it as middle class, but I think I'd like to say it has shown us that ordinary people in these circumstances all of us are vulnerable. And I think in that vulnerability, we need to develop the strength and resilience to be able to deal with. And if we can teach our children the same kind of resilience, responsibility, but at the same time, not rob them of their opportunities for childhood and for growing up, I think, we're going to accomplish a lot. I've also been watching a lot of movies on Netflix, not so much serious reading, but I must admit that we have a lot of ways in which we can, reduce our anxieties at this time and opportunities for showing that we care about each other.
Absolutely. And I think that while on the one hand, the pandemic has rendered a group of us vocal, and perhaps in an opportunistic way, on the other, I think it has heightened our awareness as a society, about the importance of mental health. And the fact that we are talking about mental health today in Lit for Life for the second year in running, as far as I know, but also the fact that there is a large number of people out there who are interested and who discuss it and who are open about it today. And one only hopes that that tribe will increase. The number of people who are aware, willing to talk about it, and are willing to be open about the importance of mental health, because it is an invisible disability. When I break my arm, everybody knows that I'm in some way disabled. When my mind is broken, people don't even recognize that that's probably what's happening to me. And I think the good thing is that we have a younger generation which is not just aware, but also willing to express itself. And I hope the positive outcomes of the pandemic is that we will become more vocal about mental health. Thank you, Professor Pratima Murthy, Professor Shekhar Sheshadri, Dr. Samitra Patare. Thank you very much for joining us in Lit for Life in this discussion, and for your most enlightening remarks, which I'm sure will be of great interest to the audience. Thank you so much.
Thank you.
Thank you so much for such a valid and pertinent discussion. We hope to be able to take back some valuable lessons from this and truly deliberate upon them.